and ask audience to participants to ask their question and answer if there is any question and answer. There is one question in our chat box. Is there any U antigen blood group? I would like Dr. Rahul, if you are able to answer this. Otherwise, I can take up this question.
So, U blood group system is a part of the MNS blood group system.
Yeah,
you see with African population. So it is there. It's not that it's a part of MNS blood group system where it is the combination of antigens of MNS, and that is measured as the U antigen, where we lack those antigens.
Yeah. Is there any question? Please put in the chat box.
No, I also don't see any other question in the chat box. But I would like to ask one question from Dr. Rahul. As you mentioned that everyone knows that there is a cutoff of hemoglobin level after which we can give the donate the blood. And we have existence of anemia also. So we are simultaneously struggling with Anemia Mukt Bharat. We are trying to make all the moves. So in your opinion, what best could be done so that anemia can be promoted and more people can be, anemia can be prevented and more people can be motivated to donate blood? So what kind of activities any organization or any blood bank or any diagnostic center, any hospital should do on even other communities also? Because after seeing your slides and presentation of both of you, it came across that we all should do it together.
So thank you, ma'am, for the question. And one thing which I really feel is that we have been struggling with thalassemia, we have been struggling with anemia. Why not to combine both things? We start screening the teenage population, maybe 16 to 18 years for the thalassemics and anemia, because these will be the future donors. So while combining the schools and colleges into these programs, rather than going to the fields and doing, as we know that there is a village or a city who are anemic, that is something which I find and treat them. But better would be if we go to schools and colleges in the age group of 16 or maybe 15 to 18 years, both males and particularly females, screen for thalassemia. You find females, if she's a thalassemia carrier, we go ahead with the thalassemia screening, further screening. Or if we find a female, because in India, females tend to have a lower hemoglobins. So we can introduce those iron supplementation or the diet modification in the late teens to improve the hemoglobin. And later on, when we screening them, we can also educate about how we can make them and recruit them as volunteer blood donors. That is one aspect which can be also implemented.
Basically, as Dr. Kamini had also mentioned, that it's not very well promoted by the media or other communities, blood donation, encouraging blood donation to the people. So there is another question, Dr. Yoganand, I think Dr. Ankush has again posed.
I think as we U antigen is the antigen blood antigen system.
With U group, which other group we can transfuse?
Yeah, it is a part of MNS system, and if it is a U antigen is present, then you should look for the antigen typing and this extended typing. Then only it is affecting. Otherwise, there is no otherwise rule. We are not using commonly MNS system in our cross-matching and all.
And for minor thalassemia with hemoglobin 8, which medicine we can use in pregnancy? So will you be able to take up this?
There is no need for treatment for minor thalassemics. No drugs are being given to those patients. I think hemoglobin is well tolerated till 7.5 in 8 in pregnant females. But it's a normal hemoglobin or a thalassemic minor. Though no medication is required. We're talking about thalassemia minor, not major.
actually, many people are also not aware about thalassemia screening also. It's available in big cities and big hospitals, that antenatal, it's part of antenatal screening also. So that after delivery, the baby can also be screened, but not in many cities, because we receive so many patients in our hospital. They come to know much later when child is highly anemic and all that, yes, that is thalassemia trait or something. So I don't think, Dr. Yoganand, there are any other questions. Actually, this topic needs more and more awareness. What I could understand after seeing Dr. Kamini's and Dr. Rahul's wonderful presentation. So we can wind up, Dr. Yoganand. Dr. Yoganand, are you there?
Yeah, I'm there. I'm just writing the question and answer. One had posted some other question in the chat box, so I answered them in the chat box only. Actually, wonderful session by both the speaker, and I think we should wind up. Thank you very much for thank you, Dr. Mamta, for wonderful. Thank you, Dr. Rahul and Dr. Kamini. Thank you.
Thank you very much.
So, yeah.
I'm just driving back home,
Thank
so I'm so sorry. I'm trying to join, not
So no,
driving.
I also would like to thank both of you on behalf of Caho Diagnostic Division, that you have taken our knowledge to a different level regarding the role of blood bank and the importance of blood donation, and how far behind we are, the number of population we are catering to, and how many more donations we are required. But as we discussed, anemia, coexistence of anemia also is a major problem, which is a major deterrent. So together we can work, and the blood bank people are really doing a great job. And today was a very hectic day, and despite that, you people have given us time, so we are extremely thankful. And we are thankful to our audience also to be with us. And special thanks to Dr. Yoganand also to moderate this session. And again, special thanks to our Caho Secretariat also, because they are really proactive. They get back, they get after us live, that please suggest some good speakers, suggest this. Because of them, it is possible that in a short span of time, we are able to organize such wonderful events, and such education series is continuing for so many years. So thank you very much. And Dr. Rahul and Dr. Kamini, special thanks to you. And if you feel anything which we can promote regarding these kind of activities under Caho Diagnostic Division or Caho, so please do let us know, be in touch. So it will be really good. And let's join hands to motivate more and more people to donate blood. So thank you, each one of you.
Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you, sir. Thank you, ma'am.
Thank you. Thank you very much.